Every day, new patients arrive by the dozen, most of them presenting bullet wounds. In mid-March, Abidjan plunged into chaos and the population found itself trapped in the fighting between pro-Ouattara and pro-Gbagbo forces. Abobo Sud Hospital became increasingly isolated and medical supplies began to run low. Doctors, however, continue to work round the clock to treat emergency cases.
Le 17 mars, il y a eu une attaque sur le marché.
On the 17th of March, following a violent attack at the Adobo Sud market, we received 66 wounded. We were overwhelmed. We had patients in need of amputation, others who needed chest drains, and so on. I'm not sure we'll be able to cover medical needs if it carries on like this.
During the same period in March, further west on the road between Toulipleu and Danane, the situation appeared calm. The reality, however, was quite different. Fighting has left the western part of the country in chaos and the population abandoned.
L'idée pour accéder à ces populations, c'est de faire des cliniques mobiles.
We want to reach those people through mobile clinics. We'll be based at different sites a couple of days a week, giving people access to primary health care.
D'avoir un accès d'abord aux soins primaires.
This is what remains of Binoué Hospital, signs of looting and violence everywhere. Terrified, Ivorians were forced to flee their villages. Tens of thousands of them have taken refuge in neighbouring Liberia.
I'm from Fizende, a kilometre away from the town of Toulipleu. I fled my home. I left everything behind. I fled into the bush, and now I'm here.
With the problems in my country, you can see the worry and fear on my face. My people and my family are still there, mainly along the river. I don't know what's going on. I may have saved my own life, but what about the others?
Whether in refugee camps or in villages along the border, Ivorians are unable to tell when or under what circumstances they will be able to return home. In the meantime, the Liberian population, haunted by the memories of their own past, are doing all they can to help. A ferry converted into an ambulance enabled MSF to provide assistance to the residents of Misrata in Libya. Local medical facilities, overflowing and short on supplies, were unable to cope with the numbers of wounded. An MSF team arrived in Misrata on the 4th of April. They delivered medical supplies before evacuating dozens of wounded to Tunisia.
Well, we got 71 patients, and we considered 11 of those patients in a critical condition, and we had 2 in a life-threatening condition. And luckily it all went well during a pretty rough transport to start with, where a lot of waves.
We had to crawl on our hands and knees because if you were standing up carrying things, you always ran the risk of falling on top of somebody with a fracture or something and really doing them damage.
The journey lasted 13 hours. As soon as the boat arrived in Tunisia, 20 or so ambulances transferred the patients to different local hospitals. All of the patients survived, including those with the most severe injuries.
He was one of the critically ill patients, had bullet wounds to his chest, abdomen, legs and shoulder. Had we not taken him out, he would not have survived. He was critical at the beginning. We gave him blood transfusions and he stabilised.
Médecins Sans Frontières teams continue their work elsewhere in Libya, notably in the rebel stronghold Benghazi. Here too, medical supplies are running low. MSF has provided more than 40 tons of medical and surgical material to medical facilities in the east of the country. Buenaventura is a town of 450,000 inhabitants on the Pacific coast of Colombia. Many people have moved here to escape the violence that rages in the country's rural areas. More than a quarter of the town's inhabitants have not registered for social security. Some of them do not have any legal documents at all.
Our social work consists of helping those who either have no civil status or are not registered for Social Security, and to help them gain access to the national healthcare system. This is one of our main objectives. We are addressing people's lack of access to healthcare. First, we provide medical assistance, and then we try to make sure they benefit from their right to healthcare services.
Diana has come to the Médecins Sans Frontières healthcare centre accompanied by her mother. The little 6-year-old girl is suffering from a fever and inflammation of the lymph nodes. When she arrived, the triage and administration staff referred her to a general practitioner.
Nursing appointments and casualty cases are treated on the first floor. On the second floor, there are sexual and maternal health care services and mental health consultations too. And then, on the third floor, there is nutritional care and social and psychological support teams.
The centre has set up a family planning programme which includes birth control through to antenatal care. Victims of sexual violence, who are particularly neglected by the official healthcare system, are provided medical, social and psychological care. Aweil Hospital in South Sudan is the only referral hospital in northern Bahr el Ghazal state. Its paediatric, maternity and nutritional services are very much in demand. This increases the pressure on the logistics team to overcome certain challenges. The management of wastewater and the disposal of medical materials are amongst their priorities.
We've just submitted a proposal to improve hygiene in the hospital. Here in Aweil, infiltration levels are very low, so we need to set up alternative systems to manage wastewater. Every day we use approximately 30,000 liters of water here in the hospital. To handle such quantities, we want to set up evapotranspiration zones.
The hospital also needs to be extended. James is an architect and in charge of the building project. He's there to resolve any problems related to human resources, transport or the weather.
My assignment here is to extend IPD ward and maternity ward and to build one new IPD ward. My main challenges is to identify the right contractors to do the work because we don't have very qualified people. Another challenge is the supply of materials, which comes as a result of sometimes blockage on the roads from supply areas like Khartoum. Another challenge on the worker side is the weather conditions. We have very hot temperatures here and working throughout the day is not easy.
The new buildings will be completed by the end of June. The paediatric and maternity wards will provide approximately 100 new beds. A new delivery room will also be opening. For 3 months, this building in central Paris provided shelter for homeless refugees, mainly Eritreans and Afghans. But when the winter shelter programme operated by the charity Emmaüs came to an end on the 30th of March, the 110 people lodged here found themselves back on the streets.
I've got no money and no accommodation. My life is very difficult. I sleep in the street. That's life. It is just the way it is. I learned the expression, all good things come to those who wait.
During the winter months, Morgan visited the hostel once a week to treat or to assist the migrants in administrative and medical matters.
These people are going to find themselves back on the streets having experienced a few months of stability. On the streets, they take less care of their health. They're more preoccupied by finding a hostel of some sort.
Futur lieu d'hébergement.
Chaque soir, c'est des cauchemars qui sont différents.
Non, oui,
c'est la même chose
à
chaque fois. Différent chaque fois.
Oui.
Morgan referred those in need of medical care to a hospital or to the MSF Health Centre, also in central Paris. Although this centre is open throughout the year, it is not enough to cover their healthcare needs.
Now that they're back in the streets, it's going to be difficult to reach them again. There are different approaches. First, there's the street monitoring approach, but we also work with other partners, other charities. Either way, it's difficult to maintain contact with the migrants because they become scattered, or they hide even. Obviously, their living conditions affect their health.
MSF would like to see migrants provided permanent shelter, to which they have the right. However, the current tightening of asylum policies in France is making administrative and medical assistance to refugees increasingly complicated.